Let's talk about the risks that are involved when it comes to cosmetic surgeries.
Okay. I think I mentioned expectations.
Yes.
So that's a risk. So somebody who's 100 kilos and who gives me a picture of an Instagram model, that is an expectation that I cannot fulfill. And then it would be my mistake to do the operation.
Do you tell them?
And then not get the outcome. I try to show them before and after pictures. I try to explain. And it has to be firm from the surgeon's point of view. I can't do everything. Okay. The other risks. Now, let's talk about the medical risks and surgical risks involved. We've talked about anesthesia.
Yes.
So there are risks associated with anesthesia. There are risks with any surgical procedure. You could have a colonoscopy and get a thrombosis in your vein, a clot in your vein, which can travel to your lung. So then there is bleeding after the surgery that can happen. Again, we take all the precautions.
Profuse bleeding or just normal bleeding?
Small bleedings, maybe in the breast reduction, you can have a little bit of blood accumulating in the breast. That's why we have drains. So the drains can empty the bleeding from the wound. If there's severe bleeding, then that would be a reason to take the patient back to theater to stop the bleeding. Other risks are the more long-term risks are infection. So you might have a wound that doesn't heal properly because for some reason your skin bacteria have gotten into the wound. Prevention for that is giving antibiotics beforehand, before that even happens. But if it does happen, it's important to recognize it and treat it accordingly. Wound breakdown is another complication.
What is a wound breakdown?
A wound breakdown, or the medical term is dehiscence. That means that the body is reacting to maybe the suture, or there's too much tension on the suture line. And ideally, as plastic surgeons, have that kind of technique where we know, okay, this is just the right tension to give nice scars. But sometimes you have a wound where there's too much tension and the wound opens up. So these things can happen, and as long as the surgeon is there to deal with it and the patient is reassured and treated appropriately, then in most of the cases the outcome is fine.
Okay. Then you talked about the tension and the scars. Is there a point where the scars remain or the scars phase out?
There are always scars.
They're always scars.
Yes.
So even if I look all that ripped, I will have somewhere where Dr. Tilman sliced me and sliced me and sliced me.
Yeah, don't expect us to
smoothen it out.
Be a Photoshop specialist, no?
Yeah.
So look, anything that involves invasiveness, invasive is just even liposuction is invasive, where we put a tiny little 3 millimeter cut into your skin, and then we use a cannula to take the fat out. Even that leaves a small scar.
Okay.
Sometimes it's completely invisible. Other patients develop a keloid. So again, that's important to know beforehand. Are you prone to keloids? Then you should probably not have surgery. But again, what is a keloid? So scars are there, yes. But scars, again, can be quite obvious or can be very, very unnoticeable.